a stuck baby, and a traumatic brain injury like HIE. Believe it or not, a lot of people are not aware that a baby can get stuck. We have questions on it, and I think for some people it's curiosity, but this is a very important topic. When a baby is stuck, that medical condition is called shoulder dystocia. And normally you'll see two areas of concern when we're talking about a shoulder dystocia complication. You got to remember that when shoulder dystocia is present, it does create an emergency in the labor and delivery room. The primary injury that you can see with shoulder dystocia, or one that's most common, are injuries to the brachial plexus area. This is going to be right outside in the shoulder area. And if those nerves are injured, then you can have, of course, you can have injury to the arm, but you can also have injury to the hand. In addition to those types of injuries that are present with shoulder dystocia, you can also, number two, and the second aspect of it, you can also get what we call cord compression, umbilical cord compression. And if you have umbilical cord compression, that can be dangerous for a baby, especially if the baby is not free in enough time. Now, when I used that term earlier, HIE or hypoxic ischemic encephalopathy, our definition for that is a reduction in oxygenated blood, which can lead a baby to suffer a brain injury. Now, when you put it together and you kind of think about it, when we're talking about umbilical cord compression, you may know the umbilical cord is seen as the baby's lifeline. It is important for a lot of things, blood and oxygen for the baby. I mean, there's a lot of things that the umbilical cord is responsible for. And when you have cord compression, that can reduce or cut off, in some instances, a baby's oxygenated blood. And then you run that risk of suffering a traumatic brain injury. So that is how, when a baby is stuck, it presents an emergency. Now, when you have shoulder dystocia, it is paramount for doctors and for medical professionals to diagnose it, to understand what is happening and begin to treat accordingly. A lot of times what you could have, or when we see it and injuries show up, is that the doctors and nurses, either they don't diagnose it or they don't see it or notice it in time, and then it leads to injury to the baby. So I know that I've talked about a lot in this video, but I'm just trying to help you understand that yes, in some instances, babies can become stuck. They can get trapped behind the mother's pelvis, creating this shoulder dystocia issue, and it can lead to babies suffering injuries, especially when, like I said earlier, when it's not diagnosed the right way and doctors do not move accordingly. Maybe you're watching this video today because your baby has suffered a traumatic brain injury like HIE, and you know that your baby got stuck, and now you have questions and concerns about what was going on. Was this something that the doctors and the nurses, did they miss it, and this is why your baby has suffered this traumatic brain injury, or are there other issues that are at play? If you have that going on, what I invite you to do is to go ahead and get your phone and call me. There is a telephone number down below on the screen. I invite you to go ahead and pick up the phone and call my office and talk to us about your baby's story. Now, make sure that you understand there's no cost. There's no cost to talk with us. Be sure that when you contact my office that you leave a date and a time with my secretary so we'll know when to call you back. That is important. Be sure to pick a date and a time for us. One more thing before I get out of here this evening. I practice law here in the state of Maryland, and I know from time to time we will have individuals who will contact us, and they're not in Maryland. They are in the United States, but they're not in Maryland. Just understand that if you do contact us and you're not in Maryland, that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state, and that's something that we can work to help you on, but I just want to make sure that you understand that co-counsel or that local counsel aspect of things if you're not in Maryland. All right, that's going to be it for tonight's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care. Enjoy the rest of your day.